All right, hey everyone, this is Dr. Benac, and we are coming to you live from the Women's Clinic in Wichita Falls. So welcome to everyone who's joining us, and welcome to those of you guys who are watching this video later on. Hey, we've got a great topic for you today. We're going to keep it short and sweet. We're going to talk about endometriosis. Before we do, just a quick reminder, all of our videos are intended to give good information to our patients. They're intended to be helpful. But it's not meant to any way replace a visit with your doctor. So if you have questions or concerns about anything that I say or that you see on any of our videos, make sure and go talk to your doctor about it personally. Hey, endometriosis is a topic that a lot of women have heard about, but I think a topic that some women and many of our patients and even some doctors and primary care doctors don't fully understand. It's a condition that affects a lot of women. 10% of women in their lifetime will be affected, but it's much higher and much more common in patients with infertility or chronic pelvic pain. Anywhere from 40 to 75% of those patients will be affected. I want to tell you a little bit about what it is, some of the symptoms, how we treat it, and some information that you might need to know. So first of all, what is it? Endometriosis is where you have endometrial cells that normally grow inside the uterus growing outside the uterus. And I wanted to show you this today because I think it kind of illustrates our point. So this was in our break room, but it's just a slice of lemon. And if you think about the different layers of the uterus, you've got the outside, which is the rind. You've got the inside, the muscle, that's the white. And then the actual lemon part is the lining. And that's the part that grows every month with your cycle, and then gets released with surges in your hormones that are natural and normal for women on their period. But sometimes these cells that are supposed to grow inside grow outside. They can grow on the surface, on the outside of the uterus. They can grow on the ovary, on the fallopian tube. They can create scarring and cause infertility. They can grow on the lining of the inside of the abdominal wall and the pelvis, and they can cause a lot of pain. And so that's a good explanation for a lot of the symptoms that these women have. When you think about symptoms of endometriosis, there's 4 things I want you to remember, and they're called the 4 Ds. I'll give you the medical name, the fancy name, and then the more common name that goes with it. So the first D is dysmenorrhea, and that just means painful periods. When these endometrial cells grow in places that they're not supposed to, they cause swelling and inflammation, and that inflammation can be chronic and causes pain over long periods of time. So you get painful periods, and you get pain in areas even outside the uterus during your period. So that's the first D, dysmenorrhea. The second D is dyspareunia, and that just means pain with intercourse. A lot of these areas where inflammation is caused can make intercourse very uncomfortable, and that's a common symptom of women with endometriosis, especially when that pain is triggered more around the time of your periods. Dysmenorrhea, dyspareunia. The third one, dyschezia, which is a strange one, but that's pain with bowel movements, and again is caused by inflammation. The fourth D is difficulty getting pregnant or infertility. When we see more than one of those things, several of those symptoms, we really start to think hard about endometriosis and think about potentially treating for that or making a for sure diagnosis. So endometriosis is treated in a couple different ways. It's going to be treated with anti-inflammatory medicines. Those are going to be your over-the-counter medicines like Motrin or Aleve. Many times if you talk to your doctor, it can be treated with hormones. And what the hormones do is they prevent some of the natural surges that your body's going to have that trigger and aggravate those growths of abnormal cells. And so in working with your doctor, you can take birth control pills, different hormone tablets. You can do injections, or sometimes even IUDs can help to level out some of those hormones so that those areas of growth don't become as problematic for you. And then the third treatment is surgical treatment. And there are some times when we've tried those initial steps and we're not making progress, we do need to go to surgery. And that's the only way to for sure diagnose endometriosis, is to go get a sample of those abnormal cells, look at them under the microscope, and we can make the diagnosis that way. For patients with infertility, sometimes by removing the endometriosis, we cut down on that inflammation and we make it easier for your body to be receptive to pregnancy. And so pregnancy rates after removal of endometriosis can be as high as 50 to 60%. So that's significant for some of our patients. A couple of risk factors and then we'll finish up. So things to think about. If you're somebody who's had early cycle. So your first cycle was under the age of 11. That's a risk factor. If you have frequent cycles, if your cycles come more frequent than every 27 or 28 days, that's a risk factor. If you have heavy periods, prolonged periods, also risk factors. Things that can decrease your risk. So breastfeeding decreases your risk by a substantial amount. Pregnancy, and then exercise. Just by exercising 4 hours per week, you can decrease the amount of inflammation in your body and the effects of endometriosis. So I hope today's been helpful. If anything that we've said has struck a chord with you, if you have questions or concerns, if you have any of the symptoms that we've talked about, painful periods, pain with intercourse, infertility, heavy periods, come see us at the Women's Clinic. We'd love to talk to you and help out any way we can. I'm going to include in this video, in the comments section, there's a really cool animation. It's about 3 to 4 minutes, a link to a video that I think does a really nice job of showing what endometriosis is and how it causes some of the pain symptoms that we talked about today. So thanks for joining us, and we'll see you again soon. Thanks, guys.